Madeline Lowry, Certified MAP Method Practitioner. I'm here to answer more frequently asked questions about the MAP method and MAP sessions. So in this video, I'm going to talk about who benefits from MAP sessions. I'm going to talk about what kinds of subjects, what kinds of issues can we work on in a set of MAP sessions, and also how to prepare for sessions, how to get the most out of your sessions. And finally, how do programs work? All right, so who benefits from MAP sessions? In some ways, it's easier to talk about who doesn't benefit. So people there are three classes of people that come to mind that don't benefit from MAP sessions. One is the people who are on benzodiazepine medications. There's something about those medications that interferes with the brain's ability to rewire itself. So that's the first group. The second group are the people who are disconnected from their emotions. Disconnected in the sense of they don't want to connect to their emotions, right? They are very analytical, very cerebral. They live in their heads. They're really not interested in connecting to their emotions. So I want to say a little bit more about that, because there are some people who have a significant trauma history and feel disconnected from their emotions. And for those people, if they want to try the MAP method, if they're interested in this method, I would recommend a few sessions to see if we can improve that experience for you and help you become more connected to your emotions. So that doesn't rule out the MAP method for you, but it's more the people who have no interest in connecting to their emotions, right? They don't want to go there. For them, the MAP method is not a very good method because it is the emotion. You know, we're having the subconscious mind follow the thread of the emotions to find associations. So the third group is people who don't want the MAP method, right? So the typical situation is I'm working with someone, they're having a great experience, and they want their family member to come and see me. Well, maybe that family member is not interested in the MAP method, or maybe that family member is not interested in working on that issue at this time. Yeah, it doesn't work. Remember that your subconscious mind is in control of the session at all times. And so if your subconscious mind is not interested, doesn't want help at this point, it won't work. So what I will say about the method is it's very good for people who are very debilitated. It doesn't require much from the client, right? It's very gentle. You don't have to travel anywhere. You don't have to do that much in a session. You know, your eyes are closed, you're breathing slowly, deeply, and gently, and you're focusing on some memory. You report on what comes up during that time, while I give you instructions. That's really it. So it works well for children, it works well for teenagers, it works well for very debilitated, frail or sensitive people who wouldn't otherwise be able to travel. It's a very good modality for that. It requires only that you listen and relax and be open to what comes up, right? So we want you to not resist or repress what comes up in the mind during a round of instruction. The clients that really value this method are the ones that really value being able to understand, to be able to see the connections between their life experiences that led to the emotional, mental, or physical patterns that they're trying to resolve, right? Because that often is the result of going through a MAP session. For the person who is very logical, very analytical, what I will say is that you can get in your own way during sessions if you're trying to engage that logical, analytical, thinking mind during the session, during the rounds of instruction. So the person who's worrying, like, am I doing this right? Is this working? How is this working? It's not helpful during the session. Let the subconscious mind do its work. Conscious mind is not going to be able to figure this out. If the conscious mind could have figured this out, you would have figured it out already. Let the subconscious do what it does best. And just be open to the experience. So lastly, I want to say that this method is extremely good for certain kinds of people. There are people with certain gifts that just have a really rich experience with MAP sessions. Those people are the people who have a strong meditation practice. Empaths, intuitives, highly sensitive people, HSPs. These kinds of people have a really natural ability with the MAP method, and it's really fun to work with them and witness, the insights that they have, the breakthroughs that they have. This is not to say that if you don't fall into one of those categories that the method won't work for you. Really. 98% of the people who engage in MAP sessions with me are in the first session, they are able to see significant shifts on an emotional level. So it does work for the vast majority of people, except those first three categories I listed at the beginning. So it will work. You just have to let it. Now, what kinds of topics can we work on, right, in a set of sessions? So for emotional topics, remember I talked about in the last video how emotional topics are resolved sooner. Emotional issues like anxiety or depression, PTSD, the people who feel like they're stuck in a stress response, the people who are aware that they're having this outsized emotional response to certain situations. And then, those are the kinds of things that are usually resolved in, a few sessions, maybe 3 sessions. The mental kinds of issues, these are deeper issues. The compulsions, the people with repetitive negative thoughts, the people with addictions, the people with eating disorders, self-sabotage kinds of behaviors. These are deeper, more complex patterns, and they can take 3 to 6 sessions, depending on how serious the issue is, how long-standing, and your personal, trauma history. And then for the physical issues, this method is very good for chronic symptoms, right? So things that are ongoing, like chronic pain, chronic fatigue, chronic infections like Lyme, like viral infections, like COVID long haulers, insomnia, digestive issues, skin issues, autoimmunity, other kinds of immune dysregulation issues like mast cell activation syndrome, infertility, cancer, right? This is a wonderful modality to use alongside conventional or alternative therapies for people with cancer. And then, of course, allergies and sensitivities, which is exactly where I started. Now, for people who are wondering, how do I prepare for a session, right? How do I get the most out of each session? For the introductory session, we want an emotional topic, right? So come with a few ideas and we'll choose something. It might be a phobia, a fear of public speaking, a fear of small spaces, a fear of flying, a fear of something else. It may be some kind of trigger for anxiety for you. So whatever that may be, whatever kind of situation that may be. It may be an emotional memory from the past that still has emotional intensity for you. Or it may be some kind of emotional experience, that some event from the past that you're still having a very emotional response to, right? For like, it's been going on too long. So anything like that is a good idea for the first 60-minute session. For the 90-minute sessions, I will say that, you know, most of my client base is coming to work on physical symptoms. So whether it's physical, mental, emotional, really, if you have a sense of the stresses, the life stresses that were going on for you just prior to the onset of symptoms, make a list of those. That's a good tool to have at sessions. If you can make a list of lifetime traumas, just a quick list, you know, like parents divorce, age 4, you know, so like just a little description of what the trauma was and what age you were. Just a little list like that is a good tool to have for sessions, so we can choose topics off of those lists. There is no need to know the cause or the connection, however. So for people who just don't have any known source of stress, no known trauma, that's okay. Come to the session. We will figure out a different entry point for you, right? There's a lot of different ways that we can focus the sessions. So we will figure out what works for you at the session. You just have to know how the issue is affecting you in your current life, right? So what is the pattern, the behavior, the symptom that you seek to resolve? And we'll just take it from there. In terms of how programs work, right? So I've started to develop online self-paced programs because I want to make the process more affordable and more convenient for people all over the world. And it can be hard for people who have in time zones that are very far from mine to find time on my calendar, or to be able to, you know, book the sessions in the, at the frequency that they want to. So online self-paced programs can be a good addition to live sessions with me. I do think that this online self-paced programs reduce the number of live sessions that are needed. So someone who might ordinarily need 12 or 15 sessions, right, may be able to do a lot of work on their own with the online self-paced program that is appropriate for them, and then only need a handful of sessions, live sessions with a practitioner. So please keep in mind, live sessions are more effective, right? Because you have a practitioner working with you who's listening to your feedback, who's guiding the session, who's doing problem solving, who's responding to exactly what's coming up for you. A recorded session isn't like that. A recorded session is more like recorded rounds of instruction that are appropriate for the topic at hand, but aren't obviously personalized to you. But, you know, the trade-off is worth it, I think, because the programs are more affordable, and so you can have more sessions through a program, because there's usually a set of core sessions in the program that you can, they're generic enough that you can use them repeatedly with, you come up with different topics, and you can use these core recorded sessions multiple times And so you can actually work on a lot on your own. But for the more deep-seated trauma experiences, that is something you might want to save for a live session. So each person is different, but the programs are there, focused around different needs, just to make doing, for the person who wants to do more sessions more often, you can do up to 1 session a day with the programs. I don't recommend more than 1 session a day. But they do make it very convenient because now you can use this online self-paced program at any time of the day or night, weekend, right? When you may not be able to work with a live practitioner. And if I have not yet answered your question, please tune into the next video where I will answer yet even more questions that people ask about the MAP method, including how do we use MAP to address physical symptoms? Are there risks to MAP sessions? What is the science behind MAP? And also, how can I learn more? So tune into the next video. Thank you. Thanks for listening.